Hi everyone, my name's Nicole, and in this video I'm going to teach you two simple techniques, mindfulness breathing and a grounding exercise. These tools can help reduce physical tension, calm racing thoughts, and improve focus before practice, competition, or during rehab. These strategies are designed to be safe, simple, and something you can do independently without equipment. The purpose is that mindfulness is the practice of paying attention to the present moment without judgment. When we feel stressed or anxious, our bodies often respond with muscle tension, shallow breathing, and a racing heart. By slowing and controlling your breathing, you can reduce physical tension, improve concentration, feel more in control of your body, and support recovery and performance. Grounding techniques can help shift attention away from overwhelming thoughts and back to the present moment. This can be especially helpful before competition or when you feel mentally overloaded. These techniques may be appropriate if you feel nervous before practice or competition, notice tight muscles or shallow breathing, have difficulty focusing during rehab exercises. But you should stop if you experience dizziness, lightheadedness, or increased distress. If you have a history of panic attacks, trauma, or a medical condition affecting breathing, consult your healthcare provider before beginning new breathing exercises. These techniques are not a replacement for mental health treatment, but they can be a helpful tool to support stress regulation. The first technique is diaphragmatic breathing. I'll demonstrate seating, but you can do this lying. So you're going to sit upright with your feet flat on the floor. Place one hand on your chest and one hand on your stomach. Slowly inhale through your nose for a count of 4. Try to let your stomach rise more than your chest. Pause briefly. Slowly exhale through your mouth for a count of 6 and repeat for 5 to 10 breaths. So even though you can't see my lower half of my body, this is what it would look like. So on and so forth. You can have little cues like breathe low and slow, let your shoulders stay relaxed, focus on the feeling of the air moving in and out. If counting feels stressful, simply focus on slow, steady breaths. Some modifications are if you feel lightheaded, shorten the inhale and exhale, return to normal breathing before repetitions. If you want a progression, try box breathing, where you inhale for 4, hold for 4, exhale for 4, hold for 4. The second technique is the 5-4-3-2-1 grounding exercise. This exercise helps bring your focus back to the present moment. You can do this standing on the sideline, in a locker room, or even at home. The instructions are take a slow breath and then identify 5 things you can see, 4 things you can feel or touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. Take your time with each category. Some coaching cues include move slowly, actually look around you, notice the small details, and remember that there's no right or wrong answers. This technique works by shifting your brain away from worry and back to your physical surrounding. Some frequency and self-care recommendations include that you can practice these techniques before practice or competition, during breaks and rehab sessions, at night to wind down, and anytime you notice tension building. For the best results, practice daily for 3 to 5 minutes, even when you're not stressed. This helps your body learn the skill before you need it under pressure. These are tools that you can use on your own, anywhere, without equipment. Like strengthening exercises, mindfulness skills improve with repetition. If one method doesn't feel helpful, try another. Different techniques work for different people. So overall, today we covered diaphragmatic breathing and the 5-4-3-2-1 grounding exercise. Both can reduce physical tension, improve focus, and support performance and recovery. If you notice worsening anxiety, persistent distress, or symptoms that interfere with daily life, please consult your athletic trainer or a qualified healthcare provider. Thank you for watching, and I encourage you to practice these skills consistently to support both your physical and mental performance. Thank you.